Lecture title: Excitable Tissues and Synaptic Transmission. Electrophysiology Fundamentals and Signaling. Simple explanation. This is the introductory cover slide. It sets the stage for studying how cells generate electrical signals and communicate with one another. Why tissues are excitable. Comparing resting membrane potential, RMP, versus action potential, AP. And a signaling overview. Simple explanation. Why are nerves and muscles special? They are excitable because they have the cellular machinery to create and send fast electrical signals called action potentials. The key difference: the resting membrane potential, RMP, is universal and found in almost all living cells in the body at rest. In contrast, action potentials, active electricity, happen only in excitable tissues, nerves and muscles. Cells dynamically switch from a resting state to an active state using voltage-gated ion channels that open and close selectively. Definition of RMP and characteristics of a polarized membrane, showing a diagram with positive charges outside and negative charges inside. Simple explanation. When a cell is completely at rest, there is a steady electrical charge difference across its membrane. The membrane is polarized, which simply means the inside of the cell is negative relative to the outside environment, which is positive. Specific baseline RMP values for skeletal muscle, cardiac muscle, and nerve fibers. Simple explanation. Different cells maintain different electrical charges at rest. Skeletal and cardiac muscle, -90 MV, they have a highly negative, deeply stable rest state to prevent random, erratic muscle twitching or uncoordinated heartbeats. Nerve fibers, -70 MV, they rest at a slightly less negative charge, keeping them closer to their firing threshold for lightning-fast signal conduction. 3 direct drivers of the negative internal charge. Kinetic contribution of potassium, and the formula. V_m\approx -70 text to -90 text MV. Simple explanation. Why is the inside of the cell negative? There are 3 reasons. Potassium efflux, potassium, K+, can diffuse out of the cell very easily because it leaks out constantly. It is the single most dominant factor determining the negative value of the RMP. Sodium-potassium pump, an active pump that continually throws 3 positive sodium, Na+, ions out while pulling only 2 positive potassium, K+, ions in, losing more positive charge than it gains. Non-diffusible anions, large, negatively charged proteins are trapped inside the cell fluid and cannot leave. Content: transient voltage inversion definition, sequential components of the AP cycle, and a graph showing the phases. Simple explanation. When a cell receives a strong enough stimulus, reaching the threshold level, its electrical charge rapidly and temporarily flips upside down. The slide's graph shows how the signal goes through fixed steps, from the initial trigger to a massive electrical spike and back down to normal. The ionic mechanisms behind depolarization and repolarization with a phase diagram. Simple explanation. How does the electrical spike happen physically? The upswing, depolarization, fast sodium channels open, causing a massive influx of positive sodium, Na+, ions rushing into the cell, driving the internal charge into positive numbers overshoot. The downswing repolarization, sodium channels close and voltage-gated. Potassium, K+, channels open. Potassium rushes out, carrying positive charges away and resetting the cell back to its resting negativity. Biophysical laws of the AP All-in-one law. Refractory periods, absolute versus relative, and a visual index. Simple explanation. Action potentials follow strict physical laws. All-in-one law. If a stimulus is strong enough, the cell fires at 100% capacity. If it's too weak, it doesn't fire at all. There are no partial or weak electrical signals. Absolute refractory period, ARP. A brief time window where it is physically impossible for the cell to fire a second signal, no matter how strong the stimulus is. Relative refractory period, RRP, the cell can fire again, but it requires a much stronger than normal stimulus to do so. Anatomy of a neuron diagram. Dendrites, nuclear cell body axon, Schwann cells, a myelin sheath, and nodes of Ranvier, and the three modulators of speed. Simple explanation. What makes an electrical signal travel faster down a nerve? 3 anatomical factors. Degree of myelination. Signals travel fastest in thick, insulated, myelinated nerve fibers. Nodes of Ranvier spacing. The signal jumps across the uninsulated gaps, nodes. Increasing the distance between these nodes boosts the jumping speed. Axon diameter. A thicker nerve fiber reduces internal resistance, allowing electricity to flow faster. How imbalances in blood sodium, Na+, potassium, K+, and calcium, Ca++. Affect electrical signaling. Simple explanation. Changing the concentration of minerals in the blood alters body electricity immediately. Sodium has very little effect on the baseline rest state, but low sodium, hyponatremia, weakens the peak strength of the signal. Potassium directly changes the baseline RMP. Low potassium, hypokalemia, causes the cell to become hypernegative, hyperpolarized, making it sluggish and less excitable. Calcium acts like a structural guard that sits on sodium leak channels to keep them closed during rest. Pathophysiology of hypocalcemic hyperexcitability, unguarded channels, continuous influx, spontaneous APS, and tetany pathology. Simple explanation. What happens if blood calcium levels drop dangerously low? Hypocalcemia. The sodium leak channels lose their regulatory calcium guards. Without guards, sodium ions leak into the cells continuously even when the tissue is supposedly at rest. This triggers non-stop, spontaneous action potentials without any real external signal, causing skeletal muscles to lock up in painful involuntary sustained contractions known clinically as tetany. Definition of the synapse, chemical transmission concept, and synapse anatomy, presynaptic neuron, synaptic cleft tilde 20 nm, and postsynaptic membrane with receptus. Simple explanation. Nerve cells do not physically touch each other. There is a microscopic, fluid-filled gap between them called the synaptic cleft, tilde 20 nm wide. Because electricity cannot jump over this gap, the electrical impulse is converted into a chemical message, a neurotransmitter, to cross the space. The 4 steps of chemical release: AP arrival, calcium influx, vesicle fusion via exocytosis, NT emptying, and the 4 possible fates of the neurotransmitter. Simple explanation. How is the chemical released? Electrical signal arrives /right arrow. Calcium channels open and calcium enters /right arrow. Calcium pushes chemical storage bags, vesicles, to merge with the membrane /right arrow. Neurotransmitters spill into the gap. What happens to the chemical next? It can bind to the next cell's receptus, get broken down by local enzymes, get recycled back into the original nerve, reuptake, or drift away into the bloodstream. Diagram of a synapse showing acetylcholine, ligand-gated channels, and the ionic mechanisms of excitatory, EPSP, and inhibitory, IPSP. Potential shifts. Simple explanation. When the chemical reaches the receiving cell, it causes one of 2 reactions. Excitatory, EPSP opens sodium or calcium channels, letting positive ions rush in. This creates a small local wave that pushes the cell closer to firing an active signal. Inhibitory, IPSP opens potassium or chloride channels, driving positive charges out or negative charges in. This stabilizes the cell and keeps it quiet and turned off. 5 core properties of synapses: neuromuscular junction, NMJ, diseases and toxins, myasthenia gravis, snake venoms, and botulinum toxin. Simple explanation. Synapse rules. Signals only travel in one direction, pre/right arrow post. There is a tiny delay, 0.5 milliseconds, to release chemicals, and a synapse can suffer from fatigue if it runs out of neurotransmitters. Diseases and medical issues at the muscle junction, NMJ. Myasthenia gravis, an autoimmune disease where the body destroys its own. Acetylcholine receptors causing severe muscle weakness. Snake venoms, blocks acetylcholine receptors, directly causing sudden dangerous flaccid paralysis. Botulinum toxin, Botox, blocks the machinery needed to release acetylcholine from the nerve in the first place. A multiple choice question about A. 42-year-old patient with myasthenia gravis who improves when given an acetylcholinesterase (ACE) inhibitor, identifying option B as correct with its medical rationale. Simple explanation. This is a clinical test of your knowledge. The patient gets better because the drug stops the enzyme that breaks down acetylcholine by keeping the neurotransmitter in the gap for a longer time. It gets more opportunities to bind to the few remaining healthy muscle receptors, successfully improving muscle strength.